Hello guys, I'm I'm back again with another video. I'm trying to upload daily so that you guys can prepare well for upcoming PLAB exam. In my previous two videos, I think I talked about communication skills. I think I have finished this. Yeah, okay, I finished this history taking skills. Okay, so today is a very important topic. Just follow my videos from the beginning and do not think that it is so haphazard or anything like that. I'll just keep I'm just uploading videos according to the notes that I have prepared. Like I followed this same pattern. First of all, I just went through the communication skills. So these are the basic things you should know. I have already talked about this video in my first video. So history taking skills, so these are some general skills that you should know. So I'll come one by one. Everything will be like everything will be given in the video in the upcoming days. Okay, so today we'll just learn about the how to start a station. It's an intro. Okay, do not worry about. I'll talk about the flow of the consultation, like how it should goes, like the PMAFTOSA thing, like everything we'll talk about in the next video. But first, just just have some patience, and today we'll learn just about the starting a station. Okay, so this is a very important topic. So the real real lecture, or I don't know, like real, I will not call it a lecture because I'm not a professor, but yeah, so real learning towards your lab exam is I think it will start from today. So how to start a station intro. Always the first thing you'll remember is grips. This is very important. Grips, which means greet. Always greet your patient as soon as you enter the cubicle, inside the cubicle. Okay, some rapport building which will be done by your introduction, then purpose of the consultation, and do not forget guys, smile, smile, smile. This is very important. When I was a mock examiner, there will be a separate marks for the smile portion. So we have to grade like how the candidates enter to the cubicle and how they will present themselves at first, like whether they have a sad face, whether they have a neutral face, or they have a smile face. So smile is obviously a good. You're not supposed to laugh like like that, but a sweet gentle smile in the beginning of the consultation. And after speaking to the patient, you can change your facial expression, like so if a patient is saying, doctor, I'm so much in trouble, like I have so much hardship in my life going on, this headache is getting worse and worse, something like that, you are not going to just sit there and smile. With a smiling face you will answer that. You will question the your patient. You are not going to be happy about it. So obviously the first thing you are going to do with a smiling face, you just hello, you'll just greet them and you'll introduce yourself, and after listening to their concerns or the symptom, you'll change your facial expression accordingly. Okay, so you have to be careful with that. You are not going to smile throughout the whole station. Just the beginning should be smile, so that you are welcoming the patient with a graceful and beautiful smile of yours. Okay, so that is the first thing. Smile, smile, smile is a very important thing to do, and as soon as you enter the cubicle. So greet. Greet can be anything. Hello, so good morning, and how are you doing? So anything. So what I used to use was hello. It was a very short, time efficient, and a good thing with a beautiful expression and a smile. Okay, so just like hello, yes, hello. And one very important thing is that whenever I took a mock, the candidate used to just I don't know, like they sound very robotic, like as soon as they enter the with a even they used to smile, like with a smile they say hello, my name is Dr. Sir, anything like that. So there's no any pause. If you are saying hello to a patient, then of course you are expecting some response, right? You're not going to say like hello without waiting a response. My name is Dr. Shrestha. At least it just take a few milliseconds to wait. Hello, just say that. Okay, you enter the cubicle and say hello. Obviously the patient will say hello. You just wait for that hello or the response of the patient. Do not wait for more than 1 second. Like if the patient doesn't say anything, you just continue, but at least wait for their response. Okay, so hello, patient will say hello, then you'll introduce yourself. So you'll say, my name is Dr. Shrestha, or anything like that, XYZ. And okay, so this is a very important thing. State your role. I'm one of the doctors, I'm one of the FI2s, anything in the department, in the surgery, in the emergency department. So how you are going to say this? So you have to be very careful what is written outside of your cubicle. You do not be afraid, like do not be take tension of the, do not take a headache of these things, because it will be mentioned in your outside the cubicle. So they will give you are a FI2 in the primary care. Okay, so and there can be you are a FI2 in the emergency department. So according to that, you'll say that I am one of the FI2s in the emergency department, whatever it is written outside the cubicle. Okay, so it is easy. So you have to be careful about that also. So you have this 1 minute of time before entering to the cubicle. So you are going to utilize that, where you are and what is your role. So this also bears, like, I don't know, some kind of marks, some points to you. After that, you are going to check the identity. This is also written outside the cubicle. Today you are going to talk to Mr. James Brown or Mr. Smith, anything like that. So that you have to remember that, and you can say, okay, so are you Mr. James Brown? And yeah, you can say that. But for me, many of this is a good way to sound very nice, because you are remembering what the patient name is. But for me, it has always been very difficult for me to remember the name. I don't want to take that burden of remembering the name, so I don't used to, like, even bother with this is my weakness actually. So I would not advise you guys to do that. But by any chance, if you forget the name of the patient, once you enter the cubicle, you forget what is written outside. What I used to do was, actually I used to do this in all of the station. I just used to say that, okay, so I used to introduce, I'm one of the doctors in the emergency department. So how would you like me to call you? So I would just ask that. By saying this, I have solved my two problems. One, patient will say his or her name accordingly, and they'll also tell their preferred name. So I used to even save time, and also I don't have to bother remembering the name. Okay, so how would you like me to call you? Or directly you can say, okay, so today what how would you like me to address you, something like that. And you'll say, okay, you can, yes doctor, you can call me Mr. Brown or James. Or the best another way is to address the situation is that, okay, so may I know your full name and age please? Or may I know your full name and date of birth please? And you'll say, okay, my name is Mr. James Brown, I'm born in this year. And after that you can say, okay, how may I address you? So this is the best approach that you can get, the two questions. May I know your full name and date of birth please? Or may I know your full name and address please? Or may I know your full name and age please? So anything. Okay, so after that you have to say, okay, so how may I address you, or what would you like me to call you, anything, follow-up questions. Okay, so identity is finished. Now name preference, I have already talked to you about it. Okay, nice to meet you, and what would you like me to call you, I have talked about this. Okay, and the last thing is, after everything, you are going to say, how can I help you today? So what has brought you to the hospital or surgery today? So okay, so you can say this. So this is just asking that, this is an open question. And the patient will say, okay, I'm having this headache, I'm having a stomach ache, I have been having this nightmare, I'm not able to sleep properly, something like that. And you can follow up the question, can you tell me more about it, something like that. Okay, so this is just the thing. So I think it is understood, right? So first you'll just greet, give your short intro, and you have to state your role. Then check the identity of the patient. Name preference already included in the identity. You can ask the two clever questions, like, can you tell me your full name, may I know your full name and age please? And after that, what would you like me to call you? Okay, so after that, okay, oh, one thing I just forgot, this is very important. So what would you like me to call you, or how may I address you? Then person will say, okay, you can call me James. Then respond to that statement. Okay, you are going to say, okay, you are not going to omit those sentences. You have asked a question, person has replied, so give response to it. You can say, nice to meet you James, nice to meet you Smith, Mrs. Smith, whatever the preferred name the patient gives. So it is a very nice statement. Okay, nice to meet you. After asking what would you like me to call you, just greet them again, like, nice to meet you, good to know. Okay, so something like that. Okay, so okay, so this is kind of an introduction. And there is another thing also, like, there will not always be a simple consultation. Sometimes there can be a follow-up, or the patient is already admitted to the department. at that time there's a slight difference. Okay, so greet the patient would be somewhat similar, introduction would be somewhat similar, and role also, I think this also be the similar. And by checking the identity, at this point it is very important to like say, are you Mr. Brown or something like that, because because when the patient is admitted or when patient is in the follow up, so I most of the time you are the one who is calling the patient to see you, so it is better to know the name of the patient in this kind of situation. So at this time it is, you'll not like fail the exam if you say, okay, may I know your full name or age please, but it is better to say that, are you Mr. James Brown. You have to like remember the name, because you know, it sounds more sincere to your profession, like at least you know the patient who is admitted and you know like who is going to who is coming for a follow-up. So do you understand? Okay, so after that you can say preferred name and something like it, and rest of the things is similar. Okay, and sometimes there might not be the patient itself, himself or herself. You might be talking to the patient relative, patient guardian, something like that. Okay, so in that case everything will be similar, but the only the thing is that by like rather than asking what is your name, you can ask what is your relationship to the Mr. something, like to the patient. Okay, are you following me? Like after the keeper it is written that you are talking to a you are talking to the father of Mr. Elliot James. So we are going to say, what is your relationship with the Mr. Elliot James, and you will say, okay, I am his father or something like that. Okay, so this is the other type of the question. And in this kind of situation also, if you forget the name of the patient, you can just simply say, okay, so what is your relation to the patient. Okay, so but that is not a good thing to say, but just a backup plan. Just always have a backup plan in case you forget the diagnosis, if you forget the management plan, if you don't know how to, always keep a backup plan what are you going to do if you are in the worst situation. So if you don't know what, like the patient name, so what is your relationship to the patient, but the best thing would be obviously to remember the name of the patient. So what is your relationship to the Mr. James, and he'll say, I'm his father, I'm his daughter, I'm her grandfather, something like that. Okay. Okay. And in the follow-up case, what happened, I don't know, I just forget this. Okay, so in the follow-up case you are going to say, okay, so explaining the role. In the normal situation you'll say, okay, so I'm here to talk about your symptom today, I'll be seeing you today, something like that. But when the patient is for follow-up or something admitted to the hospital, you are going to use this sentence. Okay, so I understand you are here for the follow-up, or you can say, okay, I understand you have been admitted to the hospital, I also understand you had some blood test done and investigation done. So you have to use that, whatever it is given outside the cubicle, the information will be already provided to you, like the patient is admitted and he has done some blood test, something like that, and you are just going to repeat that. Understand you are here for something something and something. Today I'll be talking more about it, or you can say, today I'll be talking about your further management plan, today I'll be talking about the test results with you, something like that. Okay. and and remember, this is also very important, checking the prior understanding of the patient. If the patient is for follow-up or patient is admitted, obviously many doctors will see them before you, so you have to ask before. This is a simple sentence. Okay, obviously answer would be no or I don't know anything, but it is always good to ask, has anyone been here before me to explain you those investigations you had, or has anyone been here before me to explain you about your diagnosis or about your symptoms or something like that. Has anyone explained these investigations to you? So what have you been told about your condition so far? This is a very short and sweet question to ask. What have you been told about your condition so far? Has anyone been here to talk to you about your dad's, mom, or husband's condition? So this is talking to the third person, right? The relative or the son. So if you are not talking to the patient, you can say, has anyone been here to talk to you about your dad, about your husband, something like that. Okay. Okay, so and the rest, and sometimes the patient can be very hard to talk. They'll say, okay, so you are the one who is calling me, you don't know like if I know the things or not, or don't you know that I have I don't know, like you tell me, I'm here to just see you. you are not supposed to ask me something. They'll just try to be strict with you, and you can, at that time you can say, okay, so we both understand, so that we both understand the same thing, can we go through what has been happening so far? Or you can say, can you tell me what has happened so far, so that I can address your concerns better. Okay, so in any situation, if the person is being navy, or like trying to get your skin, then just be calm and say, okay, I'm sorry you felt that way. I'm just asking these questions so that I can know the things better, so I can help, so I can address your concerns better. So it is okay if you can tell me like what you already know so far, something like that. So at that time, I don't think any patient will say, no, 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 I want to trouble you, I want to get in your skin, and I will not tell. So this is a very good sentence you can use. Okay, so I can just tell me like what you already know, so that I can address your concerns better, so that I can help you like in a better way, something like that. Okay, I already talked about the purpose of the consultation. I have been asked to talk to you about your condition and address any concerns so far. So yes, okay, and this is also a very important thing. Okay, so I think if you follow this my videos, I don't think you'll be met with any new or weird scenario. Okay, so so what I'm going to talk is that sometimes, as soon as you enter the cubicle, patient will be very very I don't know, like naughty patient. I, I should not say naughty, but like they try to make it hard for you. So as soon as you enter, they'll say, oh doctor, my this head is killing me, please help me doctor. Like, I don't know, like they'll say some kind of weird thing. Okay, so without even you'll not even get the chance to say hello, and they'll already complaining, okay, okay doctor, what is my head is hurting, my leg is paining, something like that. At that point, do not lose your calm. Just be calm and say, I'm so sorry, I can see that you are in trouble, or you are having a bad headache, but can I check a few details before we can talk about your symptom or your concerns, so that I can address them better. Yeah, so this is very good statement. I'm so sorry, excuse yourself, I'm so sorry, I can see that you are having a bad headache, you are having a quite much of a trouble, but before, can I check a few details with you, so I can address your concerns better, so I can know you better, so I can help you in a better way, something like that. Okay, and after that, it's just a easy peasy kind of a things. You're just going to say grapes, whatever been taught, but it's a bit quicker. So hello, and my name is some this like, what state your role, greet the patient, know the patient name, preference, something like it is somewhat similar. Okay, okay, and oh yeah, actually this has happened to me in one of the mock exam. Sometimes patient will not just sit there, and if you just go and sit. Okay, so as soon as you enter the cubicle, there will be two chairs, and you'll be sitting, there'll be a desk in between those two chairs, and most of the time patient will be in there on their seat, and you are just going there, you will greet, and you also sit down and just talk to the patient, sit on the chair and talk to them. But what happens is that if the patient is standing and he or she is not sitting on the chair, first you have to like welcome the patient to sit down. You can say that, okay, is it okay if we sit down and talk about your condition, or something like that. If the patient says, no, I will not sit down, I'm fine, okay, then you will not sit down, sit in your chair, you also stand up and do the consultation. And time and again, by ask, like after few questions, you can say, okay, so is it okay now we can sit and talk, or will it be comfortable for you if we can sit and talk about your symptom, about rest of your symptoms, or something like that. You can just ask that, okay, time and again. Most of the time, after one or two questions, patient will just, okay, fine doctor, let's sit. They will sit. But if they don't sit, you are not going to sit on the chair. Make the patient sit in the chair, then only you are going to talk. The worst case scenario, patient will not sit, you will also not sit. It's easy. Okay, yeah, just remember, you try to use the sentence, is it okay if we sit down and talk about your condition, or talk about your son, or talk about your mom, talk about your investigation results, or anything, whatever the problem the patient is saying. Systemic review, this is not important right at the moment. I'll talk about these things in the flow of the consultation. Okay, so effect of the symptoms of the patient life. So this is also I don't know, should I talk about this or not. Okay, I'll just, it's 19 minutes. Okay, I'll just talk about it. Okay, I'll finish this today. Systemic review is just, I think all of you are very familiar with the history taking. You're just ruling out the different kind of diseases uh, which the patient doesn't have. Systemic review of the CVS, the respiratory system. Do you have any shortness of breath? Do you have any heart pain? Do you have any palpitation, racing of the heart? Sorry, I think you are not going to use palpitation term. You are going to say racing of the heart. I'll talk about these things in the next upcoming videos. Okay, so just the systemic review. Main thing is respi, heart, CVS. These two are very very important. Rest of the thing you can just add. Okay, the ortho like joint pain, any dizziness, something like that. Okay, so effect of symptoms on the patient life, it is very very important. So after talking about the history of patient illness, like about the whatever the problem the patient is coming with in your clinic, like the headache or anything, trouble sleeping, anything like that. After finishing everything, at the last you are going to ask, okay, I can see that you're having this headaches, or having this leg pain, or having this lack of sleep since like 4 months, since 1 week, since 2 weeks. It's a quite long time. Has it affected you in any other way in your life, or in your daily activities, or in your sleep, something like that? Okay, you are going to ask that. This is very important, because sometimes patient are coming with the headache, but the real concern is that they are not being able to work properly in their work. So you have to refer them to the, or you have to counsel them about the occupational health as well. So this is very important. Sometimes patient will have leg pain, but the actual problem is that, so what that leg pain is doing to him, he's not been able to go to the work, so it is affecting his income, and he's having trouble with that. Okay, so it is very important question to ask, effect of the symptoms on patient life. So what, you are having headache, you are having leg pain, but what has it what what has it done to your life, your daily life? Like, has it obstructed your sleep? Has you and Okay, so I remember one of my mocks. So the patient had low mood due to the various symptoms he has in his body. And when I asked him, okay, so you have been having this trouble sleeping since so many weeks, has it affected you any other way in your daily life? And he said, yes doctor, I cannot sleep properly, and I'm having low moods nowadays. And at that time you have to say, oh, low mood. So can you tell me how low is your mood? Can you rate me on the basis of on the score of 1 to 10, something like that? Okay, and you will say, okay, yes, my mood has been one, only 1. So it is severely low mood. It is somewhat related to the depression. I'll talk about those things, but this is very important. Okay, the next topic is eyes. Very very important. I think I have talked about the eyes in my first or second video also, but I'll say it anyway. So eyes means ideas, concerns, and expectation. Idea, what does it mean? It means that, okay, so you are saying that you are going to urine a lot of time, you are feeling thirsty most of the time. Do you have any idea what is going on with you? Do you have any idea what is happening to you? You can ask that. Okay, and do not worry, the patient might say, no doctor, I don't know, will be the simplest answer. And sometimes patient will be quite angry, and they will say, okay, I don't know doctor, you tell me, I'm here so that you can tell me those things. And you can reply those kind of absurd response of the patient by saying, yes, do not worry, I'm here to explain those things. And yeah, you can say, yes, definitely, I'm here for that. I'll surely explain what is happening to you, something like that. And if he says and sometimes patient might have some idea, I think I might be suffering from diabetes, and you can say that, okay, so that is a good so that is okay, I don't think we should say this is a good you just say that if the patient is saying, okay, I might be suffering from diabetes, and you can say that, okay, so what makes you think that you are suffering from diabetes? And he'll say, yes, my father is a diabetic, something like that. So just whenever the patient responds, you also respond them with a question. Or you can say, okay, so we'll find what is actually going on with you, because of course for diabetes you have to do some fasting blood sample. You can say, okay, we are going to find about that later, or something like that, in the incoming of consultation, something like, you can say that. Okay, concerns. So this is somewhat similar to the effects of somewhat similar to the effects of symptoms on patient life. So concern is, what does the concern mean is that, okay, so you are having these symptoms for 2 or 3 weeks, like and do you have any like other concerns, or do you have any concerns regarding these symptoms? And the patient might say, yes, I might I feel afraid that this headaches can affect my work, or my lack of sleep might affect my daily activities, something like that. So any concerns regarding your symptoms, or any concerns regarding your I don't know, regarding your loss of weight. And the patient might say, yes, I'm really concerned that I might have cancer because my father or my grandmother had the same history and she suffered and she was diagnosed with the cancer, something like that. So this is concerns. And expectation means that after finishing, what I used to do was, after finishing everything, at the last I used to ask that, okay, so today we talked about something 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 xxxx. Okay, so what you can use the sentence is that, okay, today, so is there anything else that you wanted to do other than the things that I have already told you? Or are you expecting anything, were you expecting anything different from what I have told you today? So you can just say that, are you expecting anything different from whatever I told you, or whatever I said you, or whatever I diagnosed you, or whatever the management plan we talk about? And the patient might say, yes doctor, I was expecting that I might have a CT scan, something like that. And you'll explain that whether he needs a CT scan or not. Like, okay, I understand. You can say that, okay, so why do you think you need a CT scan? Just ask that. And he said, my friend had a similar problem and he had his CT done, something like that. And you'll just say, based on the cases, that based on his symptom, whether he needs or not the CT scan. If you don't know, then you can say, okay, so I will consult with my senior and talk to you about the having CT scan or not, but for now, according to my opinion, I don't think you need a CT scan, something like that. Okay. Signposting, I already talked about this in my previous video. Signposting, the videos, so I think videos becoming very long. I don't think I should talk about the signposting again. Okay, so I don't know. I just talked about the signpost, I think, in my previous video, so I'll just skip this. Signposting means, okay, I'll just say it anyway. I'll be very quick. So do not signposting is that before entering to any section, you are just like signposting to it. Like, for example, let's talk about, okay, after finishing history of present illness, you are just going to say, okay, now let's talk about your general health, and you will ask about whether he has diabetes, hypertension, anything like that. When before talking about the sexual life, you are going to say, I need to ask you about your sexual life, okay, to get a better understanding of your condition or something like that. And okay, now let's talk about your social life. The next, before entering to the so it is, I think you guys understand. Let's talk about your menstrual cycle, and can you tell me what was the last menstrual period, or something like that. Let's talk about your social life. Okay, you're not going to ask, is it okay if I talk about the personal life? And the person says no, then what you will say? So do not ask, let's talk, just simply say, let's talk about your social life, let's talk about your sexual life, let's talk about your something like that, to get the better understanding of your symptom or something like that. And sometimes patient will say, okay doctor, what has my symptom to do with this sexual history? I don't think it is important. And you are saying, okay, you are just going to reply, okay, I'm sorry you feel that way, but these are the general questions we ask to all of our patients to get a better understanding of the patient history or patient condition. Okay, you are just going to reply, and patient say, okay sir, okay, then you can ask me, something like that. You can use this sentence. Okay. You are just going to say, this is a general question we ask to all of our patients to get the better understanding of their condition. Okay, so finish the consultation, summarize. This is, I don't think I have never ever summarized the consultation, because it takes a lot of time, already, to figure out what the diagnosis is, what the management. It is better if you get time. It is better, like, to summarize, but it is very difficult to have so much time to summarize. It's obviously, if you can, then you can summarize. You can just use this sentence, let us recap, or let us summarize what we have discussed today. And you'll just say, okay, you came with a headache, or so we planned on for just a normal analgesics for now. If the headache persists, then we'll plan for your CT head, something like that, or we'll try to refer you to the neurosurgeon, something like that. You just can tell whatever you have discussed. Okay, and do you have any other concerns at all? Do you have any expectation? Do you have any other expectations today, so from what we have discussed today, something like that? Is there anything else I can do for you? Yeah. So okay, summarize also has 2 points. So first is history. Let me go through everything you have told me so far. So just cross checking with the patient whether you missed something or not, or whether they missed something to talk about or not. Whatever the positive, just talk about the positive history. Okay. Here. Oh my god, this is getting very long. I don't know if I should finish this or not. Okay, I think this short. I'll just finish it. Okay. So responding, how you are going to respond to the patient emotions. Patient is crying, patient is expressing grief. Just remember E protocol. E means E. First E means explore emotions. V, validate his emotions. And E, empathetic response. Okay, so what do you mean by explore emotions? You look a little concerned. Okay, you do not look yourself today. You look little worried today. You seem little anxious today. Is everything all right? You're just going to use this kind of phrases. Okay, you have to learn these phrases. There's nothing, or if it comes natural to you, it is good. Sometimes person will be just looking down and catching his head, something like that. You can say, I can see that you are very upset and disappointed, or sad, or anxious. I can see that you look very worried. Is everything all right? And whenever you say that, okay, you have this, you have cancer or something like that, and okay, I can see that you did not expect this today. It was not expected. I can see that it came as a shock. I can see that you are surprised by your results, and wait for the response. Okay, so these are the things that, this is what it means by exploring emotions and validating emotions. You are just going to validate his, whatever the response the patient is showing, whatever the emotion this patient is showing. I can understand why you are upset, disappointed, or sad, or anxious, or worried. Anyone in your shoes would be disappointed at this moment. Okay, so anyone, whenever you do some error and patient is angry, I can see anyone could be angry with what has happened today. Any parent would be disappointed or worried about their child. Okay, so whenever the patient present with what is happening with this okay, so okay, so I'm so sorry, what is happening. Okay, so validating emotions. Anyone in your position would find it difficult. Another sentence is, I can only imagine what you are going through. Another would be, most people would be a little anxious about the biopsy. Okay, so these are the things. And what is the empathetic response? I am so sorry for what has happened today. I am so sorry for what you are going through. I am so sorry to hear about your dad. You know, the tone also means, you are not going to say, I'm sorry to hear about your dad. Just have that tone. Okay, I'm so sorry to hear about your dad. I'm so sorry that you have complications. I'm so sorry that you're having a terrible headache. Just also maintain that tone. Okay, sorry guys, I think the video is quite long, but yes, this is the today I just talk about starting the station intro. Okay, okay, shit, I forgot one more thing in the intro part. Sometimes you are getting telephone consultation, and it will be a quite different than the normal grips like greeting. I don't know, I think I should have made this. I don't know where I have put this telephone. Okay, telephone. I don't know, should I go? The video is quite long. I hope you guys are listening it in the 2x speed. And I'll just go through this. I'll take just about 5 minutes. Okay, so there will be a different kind of introduction when you are going to use a telephone consultation. Okay, so what happens is, okay, so there are two cases in the telephone station. Either you are calling to the patient, or you are getting a call from the patient. Okay, so two different things. Most of the time there will be is that you are calling the patient. So there are two things. Just remember this. Always first confirm who you are speaking to. You are not going to directly say, hello, I'm Dr. Shrestha. Okay, just say, am I speaking to Mr. James or Mr. Smith, something like that, whatever the name is given in the cubicle. And then you'll say, okay, I'm Dr. Shrestha from this clinic, from GP surgery, from emergency, something like that. And you're going to ask, is it right time to talk? And why you're going to ask this is, because it is very important. Patient, whenever you are calling the patient might not be free. Patient might be around some other people's, and it is not a good time to talk. So always ask, is it right time to talk with you about this or something like that. And you can say, I have called you today to tell you about the test you had done. I have called you today for whatever the reason you have called. You just say that. Okay, can you confirm your date of birth for me, please? So this is just like asking the name and confirming if the patient is really, if the person picking the phone is really the one you are calling to. Okay, can you confirm your date of birth? And this will be given in the cubicle. You just have to tally whatever the patient says. Is this the right number to call if I get disconnected by any chance? So this is a very important thing to say before concluding anything. Just ask, is this the right number to call if I get disconnected by any chance? So this is a very secure line to say. Okay, so you can say, how may I address you? Okay, whatever it says, thank you, nice to meet you, or oh sorry, you cannot say nice to meet you in this telephone station. You can say, okay James, thank you for answering, because you are not meeting them, actually you're just doing telephone. Okay, so this is a short sentence. Do not introduce yourself first. Remember, hello, are you something XYZ? I am Dr. Shrestha calling from the GP. Can I confirm your date of birth, please? Can I confirm the first line of your address? So this is a good sentence. Okay, in the UK, can I confirm the first line of your address, please? What would you like me to call you throughout this conversation? Something like that. If this line's cut, if this line gets cut, can I call you back on this line? Is this a good time to talk? How can I help you? Something like that. Okay, so sometimes when the patient calls, if you are getting a call from the patient, if the patient is calling themselves in your GP surgery or in your primary care, you are going to say hello. Patient says hello, you are going to say, ask them their name before introducing yourself. Okay, you are going to say that, and only after when you ask them their name, or we are asking only after when you ask them that what is your name or who you are talking to, then introduce yourself. Okay, so I am something this XYZ, and you are going with the consultation. So there is an example. You are going to say, hello, may I know who I am talking to? And you will say something, my James Smith. Okay, and then you are going to say, okay, I am Dr. Shrestha from clinic, from GP, or anything. Can I please confirm a few details like your full name, date of birth, or first line of address, whatever it is given in the cubicle. Sometimes they will be given full name, sometimes they will be given date of birth, sometimes they will be only given line of address. And then you'll say, okay, thank you for answering. What would you like me to call you, Mr. XYZ? Okay James, thank you for answering. How may I help you? So this is just the, okay, I think you understood in the introduction part. So this is the next kind of scenario. If you are calling, you are talking, you are going to tell those things. If you are getting a call, you are going to do these things. I think this will, I don't think anything now will surprise you in the exam. These are on the introduction. In the introduction part, I don't think you'll get confused. I already talked about what kind of situation you'll be in, what you have, what you are going to do in the worst situation. Okay, so I think this videos will help you in your exam. And if you like my videos, please do subscribe and share, so I get motivated to work to make these videos more and more. I'll if I get breaks from my work, I try to upload my videos daily or every 1 or 2 days. Okay, so subscribe and like or comment or for any suggestion you like to give me too, and I'll be coming up with the next video shortly, maybe tomorrow or the after tomorrow. We'll be talking about, I think, yes, this is very important, we'll be talking about the flow of the consultation. Okay, so see you tomorrow, or I don't know, see you next time. Good luck guys, see you soon.